Hi, my name is Adriana Rosado, and today I will be demonstrating the insertion and removal of the NG tube. Before I begin inserting the NG tube, I will make sure that there is a medical order ordering me to insert the NG tube. After that, I will gather up my supplies and enter into the patient's room, perform proper hand hygiene, and put on the proper PPE. Once I am done doing that, I will identify the patient by their ID band, as well as introduce myself and the procedure that I will be doing. I will disclaim that it is uncomfortable, but it is to relieve any nausea that they may be experiencing. And if they have any questions, I will answer them. Once I'm done answering the questions, I will grab my supplies and I will begin to assemble them. Can you see what I'm doing? No, just close this. And I will just pre-cut my tape so that it will be easier once I begin. Okay, hopefully that's enough for now. And I'll just cut one more in case. Okay. So once I'm done assembling my equipment, I will adjust the patient appropriately, make sure that they're comfortable. So I will hire them in a high Fowler position. I will make sure that it's like around elbow height or as high as the thing goes. And I will also put them at a 45-degree angle. Okay, once I put them in a high position, then I will cover her in a blanket in case she needs to vomit or gag or anything. And I will also lower the rails so that way I can get to her easily. And I will also offer her an MS basin as well. Once I'm done with that, I will begin to measure my NG tube. So I will measure from the tip of the nose to the tip of the earlobe down to the xiphoid process and add around 10 centimeters. Okay, with a short piece of tape to ensure that I don't bother her. And I am doing that. Okay, and as I'm doing this, I will put on my gloves. Okay, so I'll put on my gloves, then I will lubricate the tube about 2 to 4 inches in. Then I will provide them with an anesthetic in their nostrils and their oral pharynx. Okay. Then I would ask the patient to identify which nostril she feels more comfortable with, that she can breathe out of, so that way I'm not obstructing her breathing through her nostrils. Okay, once we have established that, I will begin by inserting the tube, making sure that the patient's head is tilted back. Okay, so I'll begin inserting it, make sure not to hurt the patient or apply pressure. If I meet resistance, I'll make sure to twist it lightly. And when we reach the pharynx, I will encourage the patient to drink as well as chin to chest. This mannequin can do that. And as she is sipping, I will push it in. And then when she takes breath, I will make sure not to insert it, or I will stop inserting it. If she is gagging or anything like that, I will ensure to stop it. I will use a pen light to check it, and if it's like coiled or anything, then I'll take it out and try to do it again. So it has reached, so I will lightly tape it onto her face.
I couldn't find my paper. I must have left it in hand, so I had to
Okay. Once I'm done with that, I will remove my gloves. And after I remove my gloves, then I will ensure that it is positioned properly. I could do this many ways. I can order an x-ray, or I can also use my stethoscope, listen to her abdomen, and insert some air and see if it's there. But I will not be doing that. I will be using the pH testing strip. So if I had another basin, MS basin, I would use that. But since she didn't throw up, I will be using this MS basin. Okay, so I'm gonna put it here, and then I'll put my pH testing strip inside. And I will then grab a syringe, but I'm going to put my gloves on for this, just in case we don't want any splashing or anything to get on our hands. Okay. So now we'll grab the syringe, and I will insert it. I will grab a little bit of the fluids, and then I will put it on the pH testing strip. And then while I'm doing that, I want to look at the fluid. I want to look at the color, the consistency, if it has like any chunks or not. And then I would make sure to document that. And now once I make sure, okay, then after 30 seconds, I would look at the strip, and then I would compare it to a chart, and I would see the pH level, okay? I'll just do this. Okay, once I know the pH level, then I'm going to measure the tube. Okay, so I'll be using inches. So I'm going to measure from the nostril to the end of the tube. So that is approximately 18 inches, and then I would document that. So then once I'm done, then I can secure it to her nose, because I have ensured that it's in the right position, and I've also ensured that, the length of it. So I'm going to be removing this one, but first I'm going to use a alcohol wipe to wipe her nose. Okay, if I had a helper, I would ask them to hold it in, so that way, just to make sure that it doesn't move. And then as it's drying, I'm going to take off my gloves, so that way I can add it, the new piece of tape. Thank you. Okay, so now that I have secured that tube on, I'm going to measure it again to ensure that during that process it didn't slide and I didn't end up, moving the tube. So okay, again, it was 18 inches, so that is good. Now I'm going to be putting back on my gloves, so that way I can remove the syringe and connect it to the ventilation, not the ventilator, the suction. Okay, so I am going to pinch it, ensuring that nothing comes out, and I will connect it. Okay, so once that is connected, I will make sure to attach it to the patient's gown. So I will ask the patient to turn their head, and I will grab a safety pin Oh, but during this time, my gloves will be off. Okay, I'm gonna grab this piece of tape. And I want to make sure that it's a comfortable position, so her head will be turned. And then I would safety pin it to the gown. Making sure that the suction, I will put that on her shoulder. She doesn't have a shoulder, but I would connect it to the shoulder. Then I will put my gloves on once more to provide oral hygiene. I would give her something for her throat, like a spray, as well as lubricate her lips so like they don't get chapped or anything, and her nostrils to make sure everything's hydrated, nothing gets like cracked or skin or anything. So I put my gloves on for that. Also, I would remove this now that the procedure's over. Okay, so once I'm done with that oral hygiene and everything, I will then put her in a comfortable position. So I will lower her down. If she wants, I would put her head down, but no. Then I'm also gonna put her rail up. I will remove my gloves. I will dispose of this. I would remove my gloves and all PPE, and then I would do proper hand hygiene. Okay, now I will be showing you how to take out the NG tube. Before I do that, I would check the doctor's order or the medical order to make sure that I should be taking it out. I would assemble my supplies, then I would enter into the room, perform proper hand hygiene, and put on my PPE. Once I do that, I will identify the patient, and then I will also introduce myself again. I will tell the patient about the procedures that I'm going to be doing, that I'm going to be taking out, that it's a little bit discomforting, but it's going to be okay. Then, if the patient has any questions, I will answer them. Once I have answered those questions, I will grab my supplies. Okay, once I have that, I will close the door and the curtains. I will position the patient in a comfortable position, which is around elbow height. And then I'll put him at 45 degrees. Then I will lower the rail. Okay, I will remove the patient's gown, little pin from the gown. Okay. I'll provide her with a disposable pad. When we take out the tube, as well as an MS bin in case she needs to throw up. Okay, now I'm putting on my gloves. Okay, I'm going to be turning off the suction. Turn it off. Then I will remove it. Okay, once I'm done removing it, I'm going to ensure that it is in the proper place. Okay, then I'm going to remove this carefully. Okay, then I'm going to be grabbing my syringe and I will be filling it with 30 mL of air so that way I can flush it now that I know that it's in the right place, because we do not want any fluids or anything coming out. So I'm gonna grab 30 mL of air, 30 to 50, and I will be pushing that in. Okay, now that I have pushed that in, now I know that it's taken care of. Okay, and it's out of the patient's nose. I'm going to ask them to take a deep breath and hold it, and I am going to be taking it out fast, making sure that, you know, I coil it in the paper. Okay, now that that is done, I'm going to wrap it up and dispose of it. Okay, now I'm going to be putting this MS bin on the side. Okay, I'm going to be taking off my gloves. And I will be putting the patient in a comfortable position. So I'm going to lower them. okay? And also I would tell the patient, you know, I would provide like oral care if they want any, and then also I would move my supplies. Also I would give them like a tissue or something if they have any tears, and then I would remove that. Now that they're in a comfortable position, then I will be checking this for the output. Sorry, I'll put up the rails, my bad. So then I would check the output, and then I would calculate it. I would make sure to chart it, anything that's coming out, and if I like gave them fluids or if I push fluids in, then I would like discount that from that, but I would make sure to chart it. So once I'm done charting it, the output and everything, I will take off my PPE and perform proper hand hygiene.